The Department of Health and Social Care says it's not trying to replace qualified doctors with physician associates, but doctors across the country are raising the alarm about what they see is the terrifying truth.
The British Medical Association has concerns that people could be confused into thinking they've seen a doctor when actually they haven't. And it warns that the blurring of roles has had fatal consequences.
The Department of Health and Social Care's project to rapidly expand so-called medical associate professions, the largest group of which are termed physician associates, has left many doctors simply aghast. None of these groups have a medical degree, nor postgraduate medical training, but their deployment in our health service has been billed as essential workforce planning, the only way to address rising patient demand and a desperate shortage of trained medics.
When you last went to the doctors, are you sure you saw a GP? If you'd in fact seen a physician associate, would you know how they differ from a doctor?
The plan has been described as one of the most singularly dishonest, duplicitous and downright reckless political responses to the NHS workforce crisis. To be clear, physician associates don't have the same training as doctors.
Unlike doctors who study for up to 7 years, physician associates only require 2 years of study.
Nonetheless, physician associates are being permitted to take on many of the roles doctors have traditionally fulfilled. The NHS employs more than 3,000 physician associates in England and plans to increase this to 10,000 by 2036.
There clearly are concerns, aren't there, with how these PAs are being used.
The Royal College of GPs has now called for a halt to the recruitment of physician associates in general practice following a consultation with over 5,000 GPs. The college says its survey found more than 80% believe the use of physician associates in general practices has a negative impact on patient safety. The disturbing results also showed half of respondents reported being aware of specific examples of patient safety being compromised by the work of physician associates, including instances of misdiagnosis and inappropriate prescribing. The British Medical Association has also called for an immediate halt to the recruitment of medical associate professionals in the UK, including physician associates and anaesthesia associates.
Helen Salisbury was one of nearly 19,000 doctors who responded to a survey by the British Medical Association. The results have been shared exclusively with ITV News. 87% believe that the way that PAs are currently used is at least sometimes a risk to patients. And 86% believe that patients don't know the difference between a PA and a doctor.
Labour has already promised to deliver the long-term workforce plan if it triumphs at the general election. And Shadow Health Secretary Wes Streeting has backed the use of physician associates, despite the alarm raised by doctors it will create a disaster for patient safety, and despite the use of physician associates having been linked to a number of tragic deaths. Physician associates working within their scope of practice have a really important role to play. But that's the problem. The key issue is that unlike every other profession in the NHS, all of which are regulated with a national scope of practice, the GMC is proposing that physician associates uniquely have their own scope of practice set locally. It's barking mad. It would allow cash-strapped trusts to sacrifice patient safety for cost-cutting to try and balance the books. It's a recipe for patient safety disaster. And you can easily imagine a physician associate moving from one hospital to another and saying, well, at my last place they always let me do X, Y and Z. Patients need to know when they are being seen by a doctor and when they are not. That's why I'm supporting doctors across the country in demanding a national scope of practice for physician associates. And I hope you will too.